Welcome to our presentation on pneumonia.
So these are just two images showing pneumonia, and then you can see up there are the normal alveoli, and then down there you can see alveoli that are affected by pneumonia, and then you see a close-up of these healthy alveoli, and then alveoli with pneumonia, there's fluid and blood cells in the alveoli, and yeah, that's what it looks like.
So what is pneumonia? Well, as we showed you before, it's an inflammatory condition of the lung, which does affect the alveoli. It often takes 2 to 3 weeks to clear up, so you can be cured if you are diagnosed early enough. Usually the elderly, babies, and those with other diseases can become very ill and have to be admitted to the hospital as soon as possible.
So it's a bacterial and viral disease, and the viruses and bacteria found in the nose and throat, that is one mode of transmission, and then also airborne droplets from a cough or sneeze can transmit the disease, and also it can be transmitted through the blood, especially during or shortly after birth. And there are approximately 450 million infections annually, and approximately 4 million people die from it per year, especially in developing countries. And the mortality rate is up to 30% for patients with severe pneumonia who require treatment in an intensive care unit. And overall, around 5 to 10% of patients treated in a hospital die.
So the symptoms for the bacterial pneumonia and virus, if you have a pneumonia that's affected by a virus, is very similar, except if you have a virus, the symptoms are usually come much slower and are not as severe or obvious. And these symptoms include chills and chattering teeth, chest pains, cough that produces rust or greenish-colored mucus, a fast heartbeat, feeling tired, nausea, vomiting, and diarrhea.
So the treatment for the disease pneumonia depends on the type of pneumonia, so whether it's a bacterial one or the viral one, and the severity of it. The basic treatment at home, which is if you have the disease to a lesser extent and a less severe, is you control fever with ibuprofen or naproxen, which would lower it, and also to drink lots of fluids, which would then loosen your secretions and bring up the mucus in your body. If you have pneumonia to a more severe extent and you end up in a hospital unit or an ICU, you'd be treated with a drip, which would bring fluids as well as antibiotics into your bloodstream, and you could potentially undergo oxygen therapy or other breathing therapies, which would allow your lungs to breathe.